So we actually had an overview lecture on the different clinical pathological patterns of tuberculosis. And we said that there could be primary tuberculosis. This primary one will become progressive primary tuberculosis. The progressive will start becoming secondary tuberculosis. The secondary can become progressive secondary tuberculosis. Then you have the extrapulmonary tuberculosis, which is basically what from the lungs, the microorganisms is now spreading to the rest of the body. So let's talk about the morphology of the first pattern of tuberculosis, which is the primary pulmonary tuberculosis. And this one is basically like the first starting. Okay, so have a view of it. I'll talk about the characteristics, how it looks like, and everything. Okay, so you should note this Ghon's complex in your mind because you might see somewhere here. Okay, so this primary pulmonary tuberculosis, it occurs mainly in patients that lack previous or artificial immunization. Okay, so now if you are not immunized against the mycobacterium tuberculosis and you get exposed to the bacilli or you get exposed to the microorganism, you go down with this. Okay, so it is actually commoner in children and may be asymptomatic, and its sources is always what exogenous. So you are basically affected from the outside, either from a patient that has it, the cough, the sneeze, you get it up, or it could be that you eat contaminated food, or it could be that somebody used spoon, somebody had tuberculosis, they use spoon, you use it, and all the stuff, right? So, however, the immunocompromised may encounter primary tuberculosis in adulthood once they lose active immunity. So, if you have a weak immune system, you have a high chance of what? Developing the disease condition. Because as I'm talking to you, me and you, we might have been exposed to bacterial organisms, tuberculosis organism many times, but we don't have tuberculosis. This is because probably our immune system stood in for us. Okay, so if you have weak immune system, you have a higher risk or higher chance of getting this. So the fate of primary pulmonary tuberculosis are, okay, it might heal, leaving behind a scar. All right, it may also what develop latency. That's like your immune system is not really strong to kill it all, so we have some left behind. So they are left behind. They are patiently waiting for when your immune system will become weak, then they attack. Okay, so it can proceed to what? Progressive primary pulmonary tuberculosis. This is in the immunocompromised. These are in people that what? They basically this type of people, they basically lack a competent immune system to stand in for them, right? So this might actually progress. So the inhaled bacilli usually implant into the distal air spaces of either the lower part or the upper lobe or the upper part of the lower lobe at the subpleural. Now this site soon appears as a grayish-white area of inflammatory consolidation, measuring about what? 1.5 centimeters, and is called a Ghon's focus. This is a Ghon's focus. Okay. Now Ghon's focus with a lymph node infection is collected what they call the Ghon's complex. Right. So the bacilli either in its free form or within Mycobacterium avium complex now drains to the hilar lymph nodes to infect it. Okay. Now the combination of the Ghon's focus and the infected hilar lymph nodes is referred to as the Ghon's complex. As I told you guys. Right. So from the Ghon's complex, it goes to infect the hilar lymph nodes. Together it is called the Ghon's complex. So in 95% of cases, host cell-mediated immune takes care of the Ghon's complex such that it undergoes fibrosis and appears as a calcified radiodense scar called the Langhans complex. Okay. Now, histology of the primary tuberculosis will show the characteristics granulomatous inflammation with or without central area of caseous necrosis. So this granulomatous inflammation is basically your body's way of kind of like trying to stand out and stand out and basically prevent any further spread. Okay, so granulomatous inflammation is like inflammation where you have like a swelling up. It will be painful to the host though, but at the middle of that swelling up, you have like those microorganisms being trapped there. Okay, so now you should recall that a granuloma is a focus of what? Inflammation characterized by microscopic aggregation of transformed macrophages called the epithelial cells that are in turn surrounded by cola of lymphocytes, fibroblasts, and occasional plasma cells. So the granuloma is like this. In the center, you have the microorganism. Around it, you have all those macrophages, lymph nodes, and all. So they are helping to actually what? Confine the microorganism so that it will not spread to cause further damage. Okay. So in addition, central area of caseous necrosis and multinucleated what? Langhans type giant cells may be seen. Okay, in primary pulmonary tuberculosis. Right. So that's it about the morphology of this type of what? Tuberculosis. I'll be seeing you guys in the progressive time.